Hello, we are going to share our experience and result of the CBL project. Let's get started. According to WHO, mental health is not just the absence of psychological illness. It's defined as a condition that everyone can handle stress confidently and empowered to show their abilities on daily life. The common causes of mental health problem could be stress, social exclusion, worse personal and social condition, unhealthy lifestyle, etc. Our big idea is mental health, which is an important issue and closely related to our daily life. First of all, our group worked together to formulate the essential questions, where it serves as the linkage between our lives and the big idea. Which type of mental illnesses are the most common? Regarding to the situation in Hong Kong, anxiety and depression are the most common mental illnesses reported by previous studies. Depression is a typical mental disorder that causes many problems. In worst-case scenario, depression can lead to suicide. Who will be the most affected by depression? According to the Center of Health Protection, persons aged 60 and above are particularly vulnerable to depression. There are very less of them seeking for help due to the lack of awareness of depression. How does suffering and potential groups affect the individual's and community health? In personal, patients with depression experiences unhappiness and emptiness. Moreover, mental breakdown will increase the risk of self-harm. In the community, chronic illnesses with depression has a significantly high healthcare costs. It is the main contributor to the global burden of disease. After discussing the answers of essential questions, we start setting up the challenge, which was achievable and immediately actionable. Finally, our challenge was increasing the awareness about depression among the elderly. In this stage, we brainstorm everything we know about the challenge, and what we still need to discover is to find a solution for our challenge. Which regions have a high population of elderly? According to the Survey of Population and Household Statistics analyzed by District Council 2013, Wang Tai Sin has the most populated elderly in Hong Kong. Also, the report indicates that Southern, Tai Po, and Sha Tin District has a significant increasing trend of elderly. Why are there less elderly seeking for help? According to the National Mental Health Association survey, there was more than 50% of elderly aged 65 and above who has a misconception that it's the normal aging process to get depressed. Moreover, in Hong Kong's situation, Lingnan University indicates that the elderly basically did not have the knowledge about depression. What has the related organizations done for the promotion of depression? To ensure we can acquire some updated information and useful skills for approaching the elderly easily, we planned to contact with MHAHK for further information. Mental Health Association of Hong Kong is an organization established in 1952 in the form of a mental health study group with a primary objective of promoting and educating the general public on mental health. Their aim is to provide quality rehabilitation services, assist people with mental illness and mental handicap to integrate into community and to lead an independent life. Furthermore, promoting and enhancing the public's concern and interest in mental health through education are also a core value. We joined the voluntary work of the survey test in the activity of anti-depression test. Before the survey test, we attend a briefing section for the survey. We were briefed about the basic information of depression and was taught how to use a survey test called the Patient Health Questionnaire to calculate the depression level immediately. We were able to conduct the survey in the voluntary work after the briefing section. The activity was distributed in 18 districts and aims to find out the prevalence of depression in Hong Kong, as well as to provide consultation to those who are in serious cases. We mainly divide into 3 groups to conduct the survey in different locations where the population of the elderly is high. such as Monshan, Taipo, Pulan. As our target age group is 65 and above, it facilitates us to collect adequate data from the elderly throughout this activity. There were only 17 out of 203 elderly who had a score above 10 in the survey. We noticed that most of the elderly basically did not know what depression is, and only a few of them point out the depression is related to mental health disease. Although the results are optimistic, it indicated that it is necessary for enhancing the awareness of depression. We had an interview with a social worker, Mr. Yu, who is the social worker and the director of Education Department of MHK. We can be more solidifying in identifying a solution through his valuable experience. What are the factors contributing in elderly depression?
其實導致老人家抑鬱嘅因素好多嘅，咁有啲係我諗比較多嘅係即係環境因素會見到啦，因為老人家開始即係踏入老年之後咧，咁特別係男性嚟講冇咗工作啦，咁如果有啲老人家好重視工作嘅，工作個重要唔係淨係賺錢啦，亦都可能係一啲嗰個即係寄託啊，生存嘅意義，咁好多即係突然間冇咗呢個重要嘅寄託咧，就即係個容易出現情緒問題啦，同埋即係隨住年紀漸長咧，啲仔女大晒啦，亦都唔需要老人家嘅照顧，咁啲老人家好多時就即係冇咗一個所謂生活嘅寄託啊，冇生活寄託咧就容易胡思亂想啦，同埋加埋即係年紀大咧就多啲病痛啦，咁特別有啲病症其實都幾辛苦嘅，有啲痛症啊、一啲糖尿啊之類咧，其實都令到老人家嘅生活其實都唔係咁開心。咁再加埋一啲老人家咧就即係可能啲仔女冇即係可能有啲都冇嗰個仔女啦，亦都可能啲仔女唔照顧啦，可能要送到老人院啦。咁佢如果加埋一啲被遺棄嘅感覺啊嗰啲咧，其實亦都容易患抑鬱症嘅。咁另一個問題就係如果佢年紀越嚟越大咧，可能佢嘅好朋友陸續離世啦，可能佢身邊嘅伴侶都離世啦。咁其實對於老人家嚟講，佢冇咗呢啲好重要嘅即係一啲依附嘅對象，或者一啲即係同佢比較重要嘅支持者咧，咁佢好容易就會有啲創傷。咁創傷如果處理得唔好咧，又會變成抑鬱。咁所以老人家相對於其他嘅人嚟講咧，係容易有抑鬱問題嘅，原因嗰個環境個影響對佢嚟講係相當之大嘅，特別係一個即係佢面對緊嘅環境，通常唔係咁樣嘅環境。
From your social worker perspective, what is the impact of elderly depression on the community or the society?
嗱，好簡單啦。如果老人家抑鬱症嘅話，佢嚴重嘅佢會自殺啦。抑鬱同自殺嗰個關係好大㗎。咁其實老人嘅自殺都偏高嘅，部分亦都可能同佢哋嘅即係比較多抑鬱問題有關。有時未必去到抑鬱症嘅。可能佢有即係抑鬱症，你都知啦，有好多個症狀啦，可能佢有部分症狀咁如果佢個老人家有抑鬱問題嘅話，咁亦都會影響咗佢同屋企人嘅關係啦可能屋企人需要特別花一啲精神去照顧佢啦。咁如果佢係即係如果仲有即係譬如有自殺傾向嗰啲更加麻煩，可能特登要揾個人要請人去照顧佢都唔定，或者係要一個勞動力。或者要犧牲一個勞動力去照顧佢，咁對屋企可能造成都相當大嘅負擔啦。
What is the factor that makes the elderly hesitate in seeking for help?
有時候佢自己有事都未必知嘅，佢自己都唔知自己有事嘅，除非去到一個好嚴重嘅地步，屋企人發現咁先至會即係送佢睇醫生咁同埋好多時候佢哋有時候都唔係唔尋求協助嘅，因為佢哋未必去睇精神科嘅，好多時候佢以為瞓唔到或者係佢老人家有時即係佢會感受到係啲身體嘅唔妥先嘅，咁對於啲身體唔妥咧，佢唔會聯想到係一個精神問題㗎。
In what way can we approach the elderly more easier?
其實有啲地方咧就比較多呢類嘅有問題嘅老人家嘅，譬如啲私營院舍咧， 好多老人嘅私營院舍咧，好多老人家其實都可能有抑鬱嘅問題嘅嚇。
What can we do to enhance the awareness of depression amongst the elderly?
咁譬如我哋做啲抑鬱測試有時都好嘅嚇。咁雖然佢哋有時候未必好識填，咁有時透過講解，咁都係一個好嘅途徑，等佢認識翻呢個病嚇。咁講座嗰啲得唔得咧？都得嘅，咁但係就都有一定嘅限制啦。如果佢本身嗰個動機比較強，佢自己嗰個認知能力比較高咧，咁用講座嘅方式都可以嘅。咁做完測試，然後咪有啲分享啊，或者有其他跟進活動咯，有啲講解啊咁。有一樣嘢做引子，然後做啲教育嘅活動咯。嗰個可以係遊戲，可以係測試，由呢啲入手，然後再加其他嘅教育性嘅活動，或者一啲分享嘅活動俾佢哋咯。
There are two essential components to identify the solution. First is to identify the target group, then decide the solution content. According to the social worker, the elderly who are living in a rich home would have a high chance suffering from depression, as they have difficulty in maintaining a healthy lifestyle, such as disability and psychological factors. On the other hand, although the elderly who lives in the community are more socially active and has a higher self-esteem, there may be some hidden cases of depression. Both of the elderly in a rich home and community with depression has a big impact and burden in our community and society. So, the components of the solution include the education talk, progressive relaxation technique, stress test, and communication. The solution aims to increase awareness of depression amongst the elderly. Finally, we decided to deliver the solution at a Pine Care Elderly Center at the Park of Ormond Estate.
或者就算平時佢哋可能翻工唔得閒幫你手咧，咁打個電話去同佢哋傾下偈咧，都可以有助幫助下自己嘅。
For the OH home visit, we start with a health talk, which provides the basic idea of the depression. We have prepared a PowerPoint with simple pictures to explain the idea in order to have an easier understanding for the elderly. It includes the definition, cause, signs and symptoms, and prevention of depression. We have educated the elderly some simple exercise. For example, stretching exercise, squeeze the hand, arm muscles. Those exercises can allow them to feel relaxed afterward.
好叻，好呢度，好嚟我哋計下數啦吓，呢度3分，加3分，3加3係幾多啊？
In this part, we have done some assessment on the depression level and general health condition of those elderly. Apart from this, we cooperate with social worker and nurse to achieve more on the assessment process. Our group mates have interviewed about 22 elderlies in the Pine Care Elderly Center. In each of the interview, we try to educate the elderly to have basic concept of depression and suggest them to speak out if they're feeling upset. Most of them were willing to share their mind and talk with us. We hope those elderly can increase their awareness of depression through the whole activity. Besides of the OH home visit, we also had some health education section held in Ormond Estate. This time, the target group has a higher ability to acquire our education compared to the elderlies in Pine Care Elderly Center. We assessed about the knowledge of depression of those elderlies, such as, do you know what is depression? The elderlies were well communicate and can be taught back the knowledge to us. We also spoke out the questions to assess the depression level of the elderlies and encouraged them to answer the questions based on their feelings. This can give us a brief feel of their daily life about what problems they are facing.
點解你會坐喺度嘅？
哦，即係你平時都係，即係你住愛民村嘅都係。
係啊。
哦，所以就嚟坐下。平時有冇同啲朋友傾下偈咁啊？
冇啊。
冇啊。好少。咁你難唔難去集中精神？即係譬如可能睇電視啊、睇報紙啊，會
集中㗎，真係啊！睇電視啊。
睇電視。你有冇睇 TVB 啲劇啊？夜晚。
有時睇㗎。
有時都會睇。
咁我哋做緊個關於抑鬱嘅測試啊，你知唔知咩叫抑鬱啊？
唔開心啊！
咁會唔會覺得夜晚好難瞓？會唔會覺得夜晚好難瞓得着覺？
嗰個嘢對你冇乜影響，應該有。
會唔會成日都覺得好攰？
點解？
會唔會成日覺得好攰？
呢個都唔會㗎，要休息時間夠。
平時會唔會食好多嘢或者冇乜嘢？
即係應該食嘅就食幾多。
會唔會覺得好難集中精神？
如果諗嘢你要集中精神啊！你
如果輕鬆嘅時候，即係可能睇緊電視啊，
小心啲去諗嘢咯。
咁都好啊，證明你冇乜抑鬱嘅煩惱啊。
人係最緊要唔好俾啲憂鬱啊困住自己咯。你諗嘢諗唔通就唔咯。做嘢啦，百變百勝嘅諗清楚先做啊。
好，唔該晒你。
At this stage, we provide a channel for them to speak out their feelings and their concerns. It enables their mind to be stimulated and experience a feeling of self-worth, and increase the awareness of depression in the elderly. Furthermore, the elderly were encouraged to share this issue with their friends. Comparison of the data between Elderly Center and Park of Ormond Estate. By comparing to the depression score between Ormond Estate and Pinecare Elderly Center, it indicates that the elderly who locate at the Elderly Center are easier to have the problem of depression. What's more is that most of the elderly basically do not know what depression is and do not have any concept about it. According to the WHO, depression would be the second leading cause of death in the year 2030. It indicates that the elderly needs to have an increase of awareness about depression. We hope our solution can increase the awareness of depression amongst the elderly and to promote the idea to the community. We wish there will be fewer elderly suffering from depression.
咁想問下，大家覺得其實除咗 public health 呢樣嘢之外，仲學咗另外額外啲乜嘢啊？即係除咗學咗課程裏邊教嘅一啲知識上嘅，
同阿爸溝通、訪問技巧咯。
Teamwork 啦，因為我哋今次都係十幾個人，係啊10幾個一組。咁以前好少 project 係咁多個人一組。咁譬如大家夾時間啊、溝通啊，透過一啲現代嘅 software 去溝通，呢一個都係一個新鮮嘅事。
同埋其實我哋可以透過同老人家嘅 communication 之間，其實佢哋會 share 佢哋嘅人生經歷俾我哋聽，所以其實呢一個係超出咗 public health 嘅範圍之內，我哋會嘅一啲人生經歷。
好啦，咁見大家提到老人家，咁我哋今次份報告咁係做關於老人家嘅資料啦。咁大家做完之後，會對老人家嘅睇法有啲咩改變？即係接觸之前真係咁樣接觸咗啦，佢哋。
我覺得佢哋你講啦，
即係可能，即係你，即係因為我就比較係而家就少接觸，相處有啲問題，真係唔係咁好。咁樣即係但係經過咗個 project 之後啦，咁同佢哋溝通多咗啦，又即係好細心咁聽你講嘢啊，又成，可能會覺得即係老人家可能即係都好似係同人哋啲朋友咁樣啊，大家一齊傾下偈咁，所以令到我對老人家嗰個想法唔同咗，係經過呢個。
係咯，可能我哋之前都對老人家可能會有少少誤解啦，可能會覺得我哋嘅代溝會好大，因為點都會相差咗幾十年咁樣啦。咁透過今次嘅活動咧，我哋就同佢哋溝通，其實佢哋都好 nice 嘅，好友善嘅，好肯同你分享佢哋嘅諗法嘅，所以我會令到我去反省到其實 都要去 take care 我哋屋企嘅老人家。
即係我自己啦，覺得當初做呢個 project 之前，覺得啲老人家咧好冷淡，即係收收埋埋。但係其實有陣時同佢簡單嘅溝通啊、傾下偈已經令到佢哋好開心。即係譬如我哋有一日去咗老人院做一個活動，咁其實同佢哋溝通，同佢哋傾下偈，同佢哋講下平常佢哋日常會做啲咩啊，講下佢哋同佢哋子女關係啊，咁梗係正面就會好開心啦。咁但係當佢哋同屋企人嘅關係負面嘅話，咁而得到我哋同佢溝通，可能佢哋會開心咗。咁呢個其實我覺得做一個護士係應該有嘅基本嘅愛心去關懷身邊嘅人，都係好重要。
Song I wrote, you might wanna sing it note for note. Don't worry,